I'm Eric Larson. I'm the Director of Psychology and Brain Injury at Marianjoy Rehab Hospital. Psychology in rehab leads to a better quality of life for patients in that it brings patients to a place where they better understand what's happening. When we work with patients, we help them understand what's wrong. We help them understand when they're getting better, and we help them understand why it is that they want to get better in the first place. Understanding their context makes all the difference in their experience of rehab. It changes the whole thing. It puts them in a place where not only do they get better functionally, they also improve their quality of life. It actually begins to impact their sense of wellness. Psychology plays a role in helping patients recover during rehabilitation through close collaboration with the other disciplines. There's an interdisciplinary team that's core to the whole rehabilitation model. All of those different professionals work closely with each other to support each other's work. One of the things that a physical therapist is going to be doing is to help a patient regain their mobility. What the psychologist brings to that therapy is to help the patient understand what they're going to do with that mobility once they've regained it. Marianjoy has such a broad team of psychologists, more than most other rehab hospitals I know of, and they have experience from a whole range of areas, all the way from pediatrics to geriatrics and everything in between. Having that expertise gives them the capacity to assist with patients who have a broad variety of different issues and helps them achieve the outcomes that they want. Incorporating psychology into rehabilitation has impacted outcomes at Marianjoy in a number of ways. It's important for rehab patients to know their why, because that will help them achieve the satisfaction with their outcome. It's not enough just to make a recovery. I don't think any patient, when they originally sign up for any kind of medical treatment, would say, it'll be okay if I get better, but if I still feel sick when I'm done. What a patient is hoping for is that not only will they improve in their symptoms, but it'll make a difference in their lives. It'll get them to a place where they're able to do the things that they want to do. It's not always easy to remember those things. Sometimes you need a professional who's been through this before, who can walk you through remembering what it is that you want to be able to do, who can help you remember the roles that have been important to you throughout your life, that'll help you even remember things that you've always wanted to be able to achieve, but maybe have never been able to attain in the past. There are a couple examples of how patients have worked with psychology to improve their rehab outcomes. In order to understand those examples, you have to, first of all, recognize that what psychologists have found is that the recovery that patients achieve ultimately doesn't bring about the happiness that you might expect. Health is not always happiness. Or to put it in rehab terms, recovery of functional independence does not equal life satisfaction. There was a patient who had a terrible accident in which they sustained multiple traumatic injuries, including orthopedic injuries, facial injuries, and a brain injury. They were aggressive and confused during their inpatient stay before they arrived at Marianjoy. By the time they stabilized and were ready to come to Marianjoy, they were talking about what's going to happen next, about what they wanted when they're done. The patient explained that they used to work at a major corporation where they were a fixer that was highly valued for their contributions in situations where no one else could help. They were very eager to get back to that. When they were discharged home and they found out that work would not take them back right away, they were devastated. They couldn't imagine what their lives would look like without that role, without being the go-to guy, without being the fixer. Psychology met with the patient several times to address this, to try and help them understand that life still had some value even without that particular role. That redefining a sense of purpose, that redefining your meaning, redefining who you are, establishing a new identity in light of how your medical situation has changed. That's where psychology really plays a role. The other disciplines are aware of how to support patients during their sessions, but sometimes between sessions you need to have a more prolonged conversation about what's going on, and it's during those sessions where you get to talk about things at length that patients are able to do the work of figuring out what's going to come next.